I've learned that COVID is a really brutal virus. From the early days when we would scope patients in the ICU, that it wasn't just a virus that affected the lungs. We could see it in the lining of the stomach and into the intestines. It brought together some teamwork. During wave, I guess at 4 it was, I was redeployed to the ICU overflow unit, which was really an eye-opener. But it was really nice to see the camaraderie amongst the other redeployed staff.
I've learned that this virus can change and change quickly. As you've seen with 5 pandemic waves, it can really come hard and come fast. And when it does, I'm very grateful that the team here at Oak Valley Health and everyone involved steps up like never before.
Vaccinations work. Right when the vaccinations rolled out, we saw a huge decline in cases and people coming in, and they're coming in with less severe cases. So
I learned that little things in life was very important, such as going out with friends, seeing people, going out to eat, having potlucks in the department. The past 2 years made me realize how much I really miss doing things like that.
I really appreciate the way that everyone works here as a group, like in a team, and we make their days better for them and better for us too.
I think these past 2 years working in ICU, I've learned how much teamwork goes into looking after our patients and how much the rest of the hospital jumped in to help us throughout multiple waves of COVID.
So I've learned to be self-sufficient, being able to do a lot of things that used to depend on other people by myself. After I kind of got to know that, I realized how important it is to have a social network and be interdependent, because I do feel like when we're together, we achieve more than I could ever do by myself.
We all have learned to live differently. We were forced to work in a different work schedules. Many of us has learned to deal with our stresses differently.
Even though the pandemic was a really challenging time, it also really taught me to advocate for my profession. As a therapeutic recreation specialist, we try not to just look at the medical side of things, but really focus on the person's emotional well-being and social connections.
I've learned how important your wellness is as a whole and how important it is to keep everything together. So your social wellness, your occupational wellness, your mental health, your physical wellness.
Say as an IT group, we learn how to change and adapt as fast as we can.
The past 2 years have been a real test for all of us, both personally and professionally. I joined the hospital during this time to support our teams during the pandemic, and I'm really proud of the work we've done in patient advocacy and providing safer, more equitable care. Many of us have also gotten really close during this time, and I can't wait for this all to be over so we can celebrate together.
Sanitize your hands, wear a mask and distance.
I learned to never give up and tell our loved ones how much we love them. I also learned how important this hospital is to our community.
I've learned that the world has come together in unity. We are all combined, we are all doing the same thing, same purpose, be safe, and keep on going forward.
What I've learned is that the disproportionate effect of the pandemic on the marginalized and racialized groups in our country will have a fallout for a long time to come. So I think what we can learn is that the best way to move forward is to find common ground, and that equity, diversity, inclusion really is not optics. It is probably the best way for us to become stronger together after this pandemic.
I've learned how important it is to maintain our humanity and our humility. These past few years have taught me to hold tight to the ones I love and to those who make me feel good. And last of all, I've learned just how strong and brave our frontline workers really are.